Good afternoon, everybody. My name is Peter Daszak. I'm the chair of the Forum on Microbial Threats, and it's a great pleasure to be here in my homeland of New York City and bring the Washingtonians to show them the real world. We know of New York City as the capital of the free world. I know that DC is really the capital, but this is where it all happens. So welcome to New York, everybody. Be careful out there. Big buildings, etc. I want to welcome everybody, including the people on the webcast. So this whole meeting will be live webcast to the world. We have a lot of people listening in. I want to just tell you a little bit about the Forum on Microbial Threats. The role of the forum is to act as a place where people focused on, and organizations focused on the issue of microbial threats can come together around big issue topics, like the one we're going to discuss for the next 1.5 days. Discuss the latest advances in the science, in the outreach, in the policy side, in the economic side, and in getting these advances into the field and into the public, and to improve health nationally and globally. Just a few recent events or recent workshops we've held over the past few years. From the top of my head, we focused on flu and Ebola after large outbreaks of those. We had a workshop on big data and what that means to public health, very diverse topics. On antimicrobial resistance, on the role of environmental change in driving emerging diseases, and on the social science issues that underpin public health here and around the world. But one thing we thought on the forum leadership that we really wanted to look at was this idea of convergence between infectious diseases and non-communicable diseases. This coincided with the idea that we would like to diversify the geography of our meetings and come up to New York City. And I can think of no better place to be than in the Rockefeller Foundation. I'm really grateful to Dr. Rao. Shalan Burke, is she in the room today? But she was very influential in helping us. And Bridget Charles for getting us up here and allowing us to use this beautiful facility with a gorgeous view of New York. But I think it is very fitting because Rockefeller's mission talks to both non-communicable diseases, international development and public health around the world, but also emerging threats. And Rockefeller's been on the front line of all of those. So bringing those two issues together is very fitting for this meeting. So I want to start off the agenda by introducing Dr. Naveen Rao for his welcome remarks from Rockefeller. And I'll just mention a few things from his bio that I think are very interesting. He's the Managing Director for Health and Senior Advisor to the President of the Rockefeller Foundation, but dealing with really forward-thinking issues around new digital tools in community health to reduce child and maternal deaths and protect against the growing burden of NCDs and pandemic threats. So that's forward thinking, it's new technology, but it's taking it into the communities that need it most. And that really sums up what we're trying to do. We're trying to get the very best science, the very best technological advances, understand what they are and how they can benefit public health here and abroad. And Dr. Rao comes from a background of both private and public sector, senior leadership at Merck & Co., where he led Merck for Mothers, which reached and empowered over 6 million women. So working with the private sector to do the public good, just very admirable work. And work with the World Economic Forum, Global Future Council on Health and Healthcare, and the Global Financing Facility for Pandemic Threats. So it's a great honor to meet you, Dr. Rao, and to hear your welcome remarks.